Started. Good morning, good afternoon, or even good evening to everyone today. My name is Lisa Langford. I'm the Global Partnership Lead for Turn.io, and I will be your host for today. Now, before we get started, I just want to do some housekeeping. We are recording this session, and we will be sharing it with everyone afterwards. We ask that you keep yourself on mute, but put your cameras on because we love to see all the wonderful faces across the globe. We recommend and suggest that you put questions into the chat window throughout the sessions. We will have a Q&A session towards the end, but in the meantime, everyone can actually answer those questions on your behalf. Then I'd like to welcome you all as the Chat for Impact community to our demo day. We have the community members here, we have funders here, we have members of the media here. So we're very excited to be sharing and showcasing the work of 10 amazing organizations. For the last 7 weeks, I've had the immense privilege to be working very closely with all of these organizations. But I'm going to hand over now to our co-founder, Pippa Yates, to tell us more. Why do we do accelerators and what have we learned together with these 10 wonderful teams the last 7 weeks? Over to you, Pippa.
Thanks, Lisa. Hi, everyone. My name is Pippa Yates, and I'm co-founder at Turn.io. And as Lisa said, I want to extend a huge welcome to all the funders and the press and the practitioners in the room today. But most of all, I want to say well done and welcome to the participants of this year's Chat for Impact Health Accelerator, and welcome to Demo Day. I'm lucky enough to have seen a little bit of a sneak peek of the demos today, and a lot to look forward to. I'm super excited for you guys to witness the work that these 10 participants have been doing over the past 6 weeks to deliver Chat for Impact services to improve health. So at Turn, we exist to scale effective support to vulnerable people everywhere. And that's why we built the Turn chat platform to enable organizations to build chatbots and chat help desks so they can support people across the global south to improve their health, education, and livelihoods. And now we know that chat is the internet for the global south. But back when we started Turn 5 years ago, this idea that businesses could use WhatsApp to communicate with their users was just starting to take hold. And I remember the very first Chat for Impact event we held in Cape Town in 2019, where we introduced 10 social impact teams to the WhatsApp business platform. And from there, Chat for Impact, the program grew from strength to strength. We then went on tour. We visited Nairobi and Mumbai when we met some of the community members here today. And then in 2020, the Chat for Impact program expanded and went virtual as the pandemic drove this enormous demand for health and education services that were both accessible and affordable. And many, many more organizations needed to learn really quickly how to use these tools for impact. And then in 2021, with the support of WhatsApp, we launched this Chat for Impact Accelerator, which is a 6-week program that provides the most promising social impact teams with rigorous training, expert guidance, individual mentorship, and hands-on implementation support, so they can launch their Chat for Impact services. And not to forget a $25,000 cash prize for each team to scale their services from here. Past accelerator winners have included Same, who's gone on to raise hundreds of thousands of dollars to scale the mental health chatbot for LGBTQ plus populations in multiple countries, as well as Darcel, the EdTech nonprofit, whose proven maths chatbot has been used by over 50,000 students in Jordan, who have answered nearly 50 million maths questions. It's now become part of the national school curriculum in Jordan, and they're soon to launch in India. And this is really what the accelerator is all about. In its 3rd year, this 2023 Chat for Impact Accelerator, in collaboration with the Agency Fund and WhatsApp, has had a very special focus: to use chat to expand a person's agency over their own health. And this year, the curriculum included expert guidance from the likes of OpenAI, the Behavioral Insights team, and White Rice, as well as best practices responses from Chat for Impact community members and alumni, Same, Vote.org, Neura Health, and Reach Digital Health, and others. Each week, participants were supported to amplify their healthcare services by leveraging behavioral science, rigorous evaluation, and responsibly designed AI. And as you know, the most important people in the room today are these accelerator participants. So I want to take a quick moment to introduce you to them. Chosen from over 375 applicants, this 2023 cohort represents a really diverse group of organizations spanning EMEA, LATAM, and APAC, working in various areas of health, including mental health, general healthcare access, maternal health, women's health, immunization, health education, and more. So first up is Access Afya, who's out of Kenya and providing primary healthcare that serves the needs of low-income markets. We've also got Aga Khan University out of Pakistan, who's dedicated to improving living conditions and opportunities for the poor. We have Cranberry Fit out of India, an exciting new endeavor that's helping women manage period pain and PMS. Help Mum Africa out of Nigeria leverages mobile and digital technologies to improve maternal and infant healthcare across Africa. Then we head across the seas to Impulso in Brazil, who are using technology to operate a next generation primary care model. iWorld Therapy out of India, who's a leading digital behavioral health startup. Coco in the US, who's addressing the youth mental health crisis. Rocket Health out of Uganda, who's a leading private digital health company that delivers telemedicine and last mile health services. Vida Plena out of Ecuador, which provides evidence-based depression treatment to marginalized communities. And last but not least, Wiser, an AI-led chatbot that is saving lives, delivering mental health support 24/7 in an accessible and affordable way. So as these organizations as part of the accelerator are sharing their demos with you today, don't forget to pop your questions into the chat and we can address those directly as well as at the Q&A at the end of the session. But before we head into that and these incredible demos from these team members, I'd like to hand over to Arash Jazan from our partner in this accelerator, Agency Fund.
Thanks, Pippa. Hi, everyone. So great to be with you today. The Agency Fund is a multi-donor initiative investing in ideas and organizations that help people navigate toward a better future. This cohort of leaders that we're about to hear from today are working to make sure everyone has access to the support of a counselor, a coach, a clinician, the support they need to navigate towards a healthier future. And we're so excited by the promise of these organizations and the work that they're doing. Harnessing the power of chat and AI to reach users that these technologies often leave behind. Inspired by their work and the leadership of Turn.io, we'll be running an open call for proposals later this year, focused specifically on large language models that enable people to navigate life's challenges and thrive with a focus on evaluating real-world impacts like the ones you'll hear about today. So without further ado, let's dive into the demos.
My name is Mercy Nelima. I'm the Patient Engagement Lead at Access Afya, and I would like to introduce you to Afya Mama Chat service that is helping pregnant women adhere to clinic visits, therefore improving their chances of a better health outcome. Access Afya delivers a high-quality, localized primary healthcare operating system designed specifically to serve the needs of low-income markets. We have developed a physical and digital healthcare network utilizing asset-light microclinics, telemedicine, patient health data to engage patients throughout their healthcare journey, from diagnosis to treatment. In Kenya, 362 women out of every 100,000 live births will die due to preventable pregnancy-related complications. Kenyan women living in urban slums are nearly twice as likely to die during pregnancy than their wealthier counterparts. This is attributed to non-adherence to clinic visits that would detect complications early and address them. Reduced access to healthcare information and quality healthcare services are the other barriers to better health outcomes. Take Joyce. She's 3 months pregnant. This is her first pregnancy, and she's unsure of what to expect, where to find help, and what to do to ensure that her baby remains healthy. She meets one of our community health workers in her community who introduces her to our clinic and chat service to support her. Joyce is now able to check her risk of developing complications through the risk assessment prompts, which encourage her to visit the clinic or contact a doctor online through our telehealth platform in case she experiences any of the danger signs. She also has access to health information that educates her on what to expect during this stage of her pregnancy at 3 months, and will continue to provide this information for the rest of her pregnancy journey. She's able to learn about her baby's development and the changes to expect in her body. She will also get reminders about her clinic visits and their importance. This will help her keep track of the tests, vaccination, and ultrasound that she needs to get. Afya Mama will also prepare her for delivery by sharing with her what to expect and a list of what to carry to the hospital. Unlike most providers, we are focusing on bringing awareness and access to the underserved population and ensuring better outcomes for them. Our Scale-Up Plan roadmap starts with the automation of the chat function that will be connected to our electronic medical records to allow for continuity of care and better customization of the chat. We'll also plan on embedding this on our telehealth platform to enable us reach more women. We also plan on integrating trained AI tools to respond to queries. Our CRM integration will enable us better evaluate gaps in individual patient journeys and inform development of initiatives to improve adherence. We invite you to use our chat service by scanning the QR code and sharing it with any pregnant woman you have in your life. Thank you.
Hi, my name is Abdul Muhit. I work at Al Khan University. Today, we will go through an application, Ilaj Aasan, and its chatbot services. Ilaj Aasan is an Urdu word, and the meaning of this word in English is treatment made easy. It's an Android-based application, and it's for the patient to avail the medical services. And the medical services provided by Al Khan Health Services Pakistan. The target population for this application are Gilgit, Baltistan, Chitral, and Karachi. But rest of the Pakistan can also avail the services. The problem which we want to address through this application is the lack of doctor, the issues in the geographical coverage such as weather, landsliding, transport issue, so that they are not like they are facing problem in getting medical services such as pharmacy services. So these are the key issues which we want to address. Through solution, we have provided them a secure video conferencing link so that they can get a telemedicine services, a medical data exchange services so that they can share the data easily, the appointment system, so that they can book an appointment prior to the medical service delivery date, and the payment methodologies so that they can make a payment online easily, such as Easy Paisa, Jazz Cash, credit card, and debit card. Till now, we have 4,272 active users, and we are providing them medical services in different areas such as pharmacy, lab services, and medical services. Through the chatbot services, we want to help our user to identify their doctor's specialty and also avail different medical services. So let me show you how the application works. First of all, I will say hi. And in response of this hi, it will give me two options. I will say find a doctor. So suppose I have a chest pain. So I will select pain, and then I will say chest pain, and then it will respond that I should see the cardiologist. I will click on this link, open this link, and I will see the cardiologist, and I can book the appointment accordingly. In future, we want to extend this chatbot services in different areas, such as giving users more awareness, content, medical awareness, and similarly screening tools so that they can have different screening tools available and they can monitor themselves easily. We will be adding more content for patient engagement. We will be using more tools, WhatsApp tools, to improve the health services as well. Thank you very much.
Hi, I am Aditi. Along with Saraswati, we are solving a problem that is very personal to the both of us. I have painful periods. 2 days a month, I take painkillers to go on with normal life. Same for Saraswati. We were both looking to take action to end this cycle of pain. We looked around in India but did not find anything. So we created Cranberry. Cranberry is an AI health coach for women to ease period pain and PMS. I have worked in governments and Saraswati has built and scaled digital products. And now together we are Cranberry.
Let me introduce you to Priya, a 29-year-old menstruator from India. Priya has experienced 200 periods and has 350 more to go. Each cycle, Priya experiences severe period pain, missing her workday. This is a story of 100 million Priyas in India who experience severe period pain and PMS each month. The good news is science has a solution: menstrual coaching. But medically verified menstrual coaching is not accessible to Priyas out there. We are here to change that. With Cranberry and WhatsApp powered by Turn, we are tackling the barriers of access, stigma, and behavior change for Priyas out there. Meet Coach Berry, Priya's personal menstrual coach for pain-free periods. Let's see how Coach Berry helps Priya.
Priya's period will come tomorrow and she is in severe pain. So Coach Berry pings her with a reminder. Priya journals her symptom and the severity, gets a remedy personalized to her, and feels some relief from the pain. Priya does not want this severe pain next month too, so Coach Berry recommends healthy habits based on her data. Priya chooses a habit to build, and Coach Berry will now ensure that Priya builds this habit. She gets weekly personalized, easy to do actions as Coach Berry removes any barriers. She joins a micro community of 20 other women forming the same habit. But there are days when Priya has personal questions she cannot ask anyone, say on vaginal discharge. Coach Berry answers them based on the medically verified knowledge base. And then there are times when Priya's body is changing. Coach Berry pings Priya with insights so Priya can prevent pain in the future.
With AI for scale, data for personalization, and community for human touch, Coach Berry is Priya's personal assistant from puberty to menopause. We invite you to interact with Coach Berry or share it with women in your life. Here's to changing women's health one period at a time. Thank you.
My name is Dr. Adurini Abiodun, and I'm the founder and CEO at Help Mom. Today, I want to take you through the wonderful work that we do at Help Mom. At the moment, Nigeria is one of the largest contributors to infant mortality in the world. We lose 2,300 under 5 children daily, and we also contribute to 30% of unimmunized children in the world. The reason why we have this high rate of infant mortality due to vaccine-related death is because poverty and lack of knowledge about immunization. What we did at Help Mom is to develop digital immunization tools to solve this problem head-on. The first one is the Help Mom vaccination tracker that we use to digitally register mothers in remote, rural areas and urban areas in Nigeria. Currently, Nigeria uses paper card to track immunization. So what we've done is to develop a digital tool in which it will be easy for the government to easily track the immunization of children in their state. And currently, we have 2 states in Nigeria that have adopted our Help Mom vaccination tracker. What we've done now is that our newly developed chat box has been incorporated into our Help Mom vaccination tracker. Before, it was SMS that was incorporated into our Help Mom vaccination tracker, but our chat box has now been incorporated, which sends reminders to mothers on when the immunization of their child is due, and also they can ask questions if they have any question about why they should take their child for immunization. The second digital immunization tool we developed is the Help Mom Advisor. We noticed that it is not all mothers that we send reminders to that take their children for immunization. So that's why we developed Help Mom Advisor. So Help Mom Advisors help us understand the barrier for every mother registered on our vaccination tracker why they won't take their child for immunization. So the Help Mom Advisor provides interventions like the health home advisor can say this mother needs travel voucher, this mother needs you to take the immunization to their home. One of the things we also did is to incorporate the help mom vaccination chat box into the help mom advisor. So what that means is that for mothers that have the financial means, the help mom advisor knows that they just need sensitization, and that's why they've not been taking their children for immunization. So the help mom chat box is what sends reminders to them, and the mothers can interact, ask questions, and this we help them take their children for immunization. At the moment, over 86% of mothers preferred the chat box to our previously used SMS. Before, like I said, we used to use SMS to send reminders to mothers to take children for immunization. But now that we launched our chat box like 2 months ago, more than 86% of mothers preferred the chat box, and also 67% of mothers took their children for immunization from the chat box reminder that we sent. And the reason why we were able to come up with this data is that we are tracking them, and these are the early results that we have. This is our chat box service. You can scan it, trigger the message on it with I or A, and you'll be able to interact with it. We have services like importance of immunization. We have a location service where you can find the nearest location to you where you can take your child for immunization. And we have loads of services on our Help Mom Vaccination chat box. I'm ending this presentation with a popular saying in Africa that it takes a village to raise a child. Today, we are calling on everybody on this call to join us and partner with us to help millions of children in Nigeria and in Africa reach beyond the age of 5 with the digital innovation tools that we've developed, like the Help Mom Vaccination Tracker, the Help Mom Advisor, the Help Mom Chat Box. Thank you very much.
Hello, I'm João Abreu, and 4 years ago, I co-founded the health tech nonprofit ImpulsoGov. We are building the next generation primary care system, starting in Brazil, the world's largest public healthcare system, serving over 150 million people, 100% for free. The system, however, is not working well enough. Every single year, over 50,000 people die needlessly because of failures in the primary care services. We are now focused on a subset of this problem: women that are dying of cervical cancer because they were not properly screened early on. This shouldn't be happening. First, cities now have the right incentives, thanks to recent legislation, to solve this problem. They get paid every time they successfully screen women for cervical cancer. Second, we have the data and technology to know who these people are. Recently, 9 out of 10 health units in Brazil use electronic health records, which allows our work to happen. For over 1 year now, we built a data product freely available that allows city governments to go to an individual level. We provide lists that allow them to know exactly which women have been left behind. Either they never did a screening or they did, but it has been a long ago. We help governments with identifying exactly who these people are. We list women that have never been screened or that were screened but long ago and they need to be screened again. With the help of this accelerator, we're going to do 2 things. First, we're going to make sure healthcare workers can actually use this product. We have a problem today. 1 in each 3 healthcare workers that receive the information to log in our system never do so. The main reason is low digital literacy, and we want to solve this with messaging. We're going to send them messages not only to remind them to log in if they haven't yet, but also with a step-by-step guide to overcome any challenges. Everyone that wants to log in needs to log in. You can check this on this QR code and also using the sentences on the left of this slide. Finally, and most importantly, on phase 2, we're going to go to the citizen level. We're going to directly message women that are behind on their cervical cancer screening. We have already done that successfully. In 1 city, we managed to more than double actually, the number of cervical cancer exams. If we manage to do this in Brazil, nationwide, we're going to avoid over 2,000 deaths every single year. That's exactly what we're going to do next. Thank you for your support.
Hi, I am Shipra Davar, and I'm the founder of I Will and Eastside Clinic, leading digital mental and wellness platform from India, talking about the need. 600 million plus people are underserved when it comes to mental wellness and reproductive health and other wellness services in India. 1 billion plus people when you look at the global south. I Will is a complete digital mental wellness and other wellness platform that has clinician-led digital programs in multiple languages, AI-based programs for preventive and mild care, and also for tertiary care, we have partnerships. Talking about what sets us apart, well, it is reach with relevance. It is agency with accountability. It is accessibility with affordability, and it is innovation with impact and interoperability. And how does that translate? Well, we've helped more than 600K plus people, of which 98% people had help for the first time. 300K plus people were from rural parts or semi-urban parts of India, and 10 million plus people we've helped through our content, through many partnerships, and through social media. Now, WhatsApp is so important for us. 800 million plus people in India use WhatsApp. And this is the demo of the service that we've built through the accelerator. We've brought our clinician-led program on the platform, and we'll bring all other services. It starts with an analysis, which is a clinically validated scale to look for signs of anxiety or depression, and then it pairs them with the right therapist for them and also the right program for them, as you can see. And then they can just book a single session or a package and have the conversation with the therapist on this platform itself. And that opens up a lot of reach and a lot of agency for people. Now, what sets us apart is that we are a team who's worked on the ground. We worked with government, we've worked with several partnerships. We are mental health professionals, we are business professionals, we are technologists, and we're people from communities. Our goal is to help 20 million plus people in the next 3 years, 100K plus people through WhatsApp in the next 1 year, bring all our services over WhatsApp, as well as our reproductive health and wellness services with intersectionalities of mental health. Thank you.
Hello everyone, Rob Knowles here, Head of Growth at Coco, and our mission is to help end the youth mental health crisis. And we are indeed facing a crisis. According to a study by the CDC, 22% of young people in the US have seriously considered attempting suicide. Now, it can take years for someone struggling with mental health to actually get help, and yet there are millions of young people reaching out for help right now on the platforms they use every day. But these platforms weren't designed to treat mental health. In fact, if anything, for many people, they can make things worse. Imagine though if all the millions of young people reaching out for help online actually got help. We could create the largest mental health intervention in history. Our team is working to make this possible. So how does Coco work? Let's imagine a young person, maybe they're 15, and they go online and they're searching for harmful mental health content online. Now, ordinarily, they might see dangerous content that can easily worsen a depressive episode. So let me show you a different story. Imagine this person searches for this content again, but this time they don't see anything harmful. Instead, they're presented with the option to try Coco's peer support service or one of our many interventions. One click and they are on a completely different mental health trajectory. I'm going to pass over to one of our real users who's going to show you how our WhatsApp bot works.
I've got to turn you guys on this peer-to-peer support chat called Coco because it's honestly something I've never seen before, and it's really been helping me feel less stressed about my life. Coco is completely free, which I love because I do therapy and that can be expensive sometimes, so it's nice to have more affordable options, and it's just a way to connect with people just like yourself about anything you may be struggling with. Makes you just feel way less alone in life. I also love that you can check up on somebody after you've given them a better perspective on their situation, and they can do the same thing for you. And remember, it's completely anonymous, and also they don't share any personal information to third-party services. So if you feel like anything's been weighing on you, but you can't talk about it, just try it out and see how it makes you feel.
So, does Coco work? Yes, we are among the most evidence-based services in the market, with multiple peer-reviewed papers, multiple randomized controlled trials, and our engagement numbers are extremely high. We've 10x'd our growth in the past year and reached over 2 million young people. And we are just getting started. We want to see a world where any young person can access a service like ours for free, zero friction, completely ubiquitous. And this isn't just about mental health. This is about saving a generation. So please join us. Thank you.
Hello everyone, my name is Alex Rukunya and I am from Rocket Health, Uganda. We offer telemedicine and last mile delivery of medical services. So the problem you're solving is that of accessibility. Taking a case in point, Harriet, a busy single mother who is a working class, has a young family and she has to make sure that whenever they are sick, they can access healthcare. But at the same time, she takes care of her elderly parents who have chronic illnesses like hypertension and diabetes. Harriet is one of the 40 million Ugandans who access their outpatient care through private health care. These often attend around 4 visits in a year and spend around $30 per encounter. If we assume that 70% of these Harriets get their health care through telemedicine, this creates a market size of about $1.6 billion for us at Rocket Health. And the solution we are offering is that of an automated chat service that will allow real-time access directly to our services. This will offer convenience in a sense that anyone, anywhere, anytime can access our services. It will be available 24/7, which will allow clients to order medicines or teleconsultation, and patients with chronic care can order their medicines and have them refilled. This is how the service works. When a customer comes to our WhatsApp, they'll simply say hi, and then they'll select the service they would like. One special thing we did with our chat service is integrating an e-commerce feature into it. The client will type in the product they want. We will return the first 5 products that relate to that string that the customer typed in. They select the product that they want, and then we start onboarding. What sets us apart from competitors is that if you look at Rocket Health, a telemedicine-centered approach, compared to other competitors like community pharmacies and community labs, we would score across variables like accessibility, affordability, and quality. Our future plan is to launch this WhatsApp chat, which will help us reach over 500,000 clients on an annual basis, which will automatically mean revenue will increase, and these learnings from Uganda will be used to scale across East African countries. And finally, our customer satisfaction rates will go high. Feel free to reach us, and the contact information is here.
Hi, my name is Joy Bittner, and I am the creator and co-founder of the nonprofit organization Vida Plena, based here in Quito, Ecuador. Our mission is to bring strong mental health to Latin America. So why Latin America? Well, because there was a poll conducted by the Wellcome Trust Foundation in which they asked people worldwide if they'd ever had a significant experience with depression or anxiety. And Latin America, at 33% of respondents responding positively, yes, they had, was the highest in the world. And then specifically, Ecuador, where we are based, is listed by Gallup as one of the top 10 worst countries in the world for mental health, alongside Iraq, Afghanistan. However, the Ministry of Health only spends 0.04% of its national budget for health on mental health, meaning the vast majority of people are unable to access any care. However, the good news is the model that we are using is recommended by the World Health Organization as being its first-line treatment in low-resource settings. It's a simple method which is composed of forming therapy groups of about 6 to 8 people who meet weekly, and their discussions are guided by a trained and certified local community member as a facilitator. There's over 15 years of evidence and research demonstrating that this is effective. And in our own pilot studies, we saw great results in which 76% of people who entered a group with moderately severe depression finished the 8 weeks with low to no depression. It's our goal, desire to be able to scale this. And so that's where we are really proud to be able to have partnered with Turn.io to be able to create a WhatsApp-based chatbot. As you can see through this example here, our goal with our chatbot is to be able to expand our outreach services, helping people to conduct self-screenings, learn about depression symptoms, and get quick and easy information about the support group that is meeting nearest to them. Our goal is to be able to scale this nationwide within 5 years. This is absolutely doable. One facilitator could reach 400 people in a year, and our goal to add 25 new facilitators each year means that within 5 years, we can treat 50,000 people for depression annually. Thank you so much for joining us in this journey and supporting us in this vision to make evidence-based mental health care available to everyone throughout Latin America.
Hello, I'm Ankita, and today I'm going to talk about our vision to help people with their mental health challenges. Visa is an AI-led mental health chatbot, and so far 6 million people have already used it, and it has saved 380 lives. And by 2030, we aim to impact 50 million lives. Do you know around 150 million Indian adults suffer from mental health disorder? And we've got only 0.07 psychologists per 1 million people. This data seems so unreal, right? And that's why 80% of them cannot get treatment. So what should an ideal world look like? Let's take a peek. This is Neelam. Neelam is a housewife. She gets anxiety attacks, but she has got a repository of tools that can help her. This is Shiv. Shiv is an Uber driver. His long working hours gets really stressful for him, but he's got a friend who he can talk to about and vent about anything, anytime. And this is Afreen. Afreen struggles with her identity, but she has got a non-judgmental friend who is helping her gain confidence to accept and love herself. So you see this gap, right? This is where we come in to bridge this gap. Meet Vyasa. Vyasa is that chatbot friend who is helping Neelam and Shiv and Afreen in that ideal world. Vyasa aims to bring mental health care to every individual right at their fingertips. Vyasa is available 24/7. All the conversations done with him are completely anonymous and it does not store any user data. The bot is designed in simple Hindi language for ease of understanding. All the tools provided are clinically validated and effective, and Vyasa aims to inculcate building resilience within people. Vyasa wants to help people with their life challenges. As soon as a user consents to start a conversation with Vyasa on WhatsApp, he then encourages them to build resilience through storytelling narrative. And then he leads them to an evidence-based self-care tool repository which is available in their local language. The chatbot also has some emergency helplines in case someone needs urgent help. So what's next? There are around 500 million WhatsApp users in India, out of which 41% are Hindi speaking. Also, data suggests that 65% of young adults prefer getting mental health support through WhatsApp. So, WhatsApp can be that platform for us to provide a democratic, inclusive, and scalable mental health care at every corner. And for this, we seek to find partnerships with public health bodies, donors, governments, and HNIs. Vyasa aims to be a part of the user's journey to well-being, while they also help others in the journey along the way. Thank you.
Wow. I don't know about you, but I am very impressed. And I think actually I'm going to try something a little bit ad lib, a big round of let's do live applause. People unmute and applause. I think these organizations deserve it. That has been a fantastic showcase of 7 odd weeks. I'm really and really well done to everyone. So now it's time for Q&A. So you get to ask them some questions. It can be anything from their use case through their journey. I'll go with the first question, and I'm going to ask it to Alex from Rocket Health. Alex, I have a question for you. What advice or recommendations would you give to future participants of accelerators, of this particular accelerator? What advice would you give to them?
Thank you, Liaz, for the question. My name again is Alex Rukunya from Rocket Health in Uganda. As you've seen in the presentation, we are delivering technology to provide convenient healthcare. So for me, I would advise the future participants to, first of all, you need to know how you would want to use WhatsApp to impact communities or any other solution you would like to provide. The first thing is knowing what you want to do with WhatsApp. And then secondly is, what are you going to do with WhatsApp? How are people going to access WhatsApp? Once you figure out the problem that you want to solve, and then you come to accessibility, how are you going to make sure that people or the target audience can be able to use WhatsApp to access your services or your impact? So in my opinion, I feel like if you understand what you want to do and the way you want to impact your target market or your community, it becomes easy to find a way of integrating chat, in this case WhatsApp, to help solve your problem you're trying to solve. And then mainly lastly is to really be open to learning, because TAN gives you an opportunity to learn from. They guide you from zero development through to they teach you how to develop, to design your chat flow and everything. It's really incredible. So I really ask everyone to go to their social media and make sure they follow TAN and be able to get updates. And when an opportunity
Fantastic.
arrives, they should be able to
Thank
take
you
it
so
on.
much, Alex. It's fantastic to have such great cheerleaders. I see there's a question that Tara asked to Cranberry. And the question I know that was answered, but perhaps Aditi from Cranberry, you would want to answer this. And this question is, does Cranberry escalate any cases where severe pain is maybe a prelude to something a little bit more serious? Perhaps you can chat us through that process.
Hi, Liz. Aditi is not here, so I'll the answer. Unfortunately,
Perfect, that's
she's
fine.
with her health. But hello, everyone. I'm Saraswati from Cranberry, and thanks so much, Tara, for asking that question. So yes, I think with health there is always fear of overdiagnosing or misdiagnosing people. So the way we manage that are two things. One, as soon as anyone comes to log their symptom, we first do a screening protocol where we check, is this a symptom that's even related to period or not? Because if it's not related to period or PMS, then we would want them to visit a medical professional. But if it's not, then we go ahead and give them interventions which are non-pharmacological in nature to improve it. And we also track it over every cycle. So after 3 cycles, that is 3 menstrual cycles, if we see that the symptom severity is not reducing or it's not getting better, that's our second escalation point. And that's also a point where we again share with the user that this is the history, this is the intervention that you already did and it has not improved, so it's time to see a medical professional. We do arrange a call of the user with a doctor on our team who equips them with the right information so that they have the right questions to ask the medical professional, which is also often a barrier. You don't know what to ask the doctor. But so our doctor does not diagnose, but they help them with the questions that they can ask and the right information. And then they are recommended to visit a medical professional. So that's how it works.
Thank you so much for that. I see there's a great question from Sarah. Maybe Sarah, do you want to ask it to the cohort, and then they can maybe decide who wants to answer that one?
Sure, happy to. And just it's more of a round robin, open to just any guidance from what seems like really incredible, tenacious founders and hard workers. So huge congrats, first of all. So we'd love to pick your brains on the great impact results that you're showing. Often we see in the chatbot space or even in the tech space or digital space that we talk about downloads and reach or time engaged. And that's impressive, yes, but just any advice you would give for going beyond that, how we get at the actual patient impact, patients helped, patients saved. I heard some of those terms. So we'd just love to hear from the team how you go about doing that and in a compliant way.
Hi everyone, Ashish from Iowa. I don't know if I can address this question directly, but okay. So having worked in mental health field in India for last 10 years almost now, I believe that if you really want to make impact, there are two things. One, adopt something like WhatsApp, which has high digital literacy rate. We were part of G20 in digital literacy and digital transformation group with Government of India and all the other governments. So WhatsApp is the easiest platform to adopt. So adopt something where digital literacy is not very high. WhatsApp is the best case. And second is what we believe and what we are also going to do is to build public digital goods. So go open source after you have validated and evidence your product. And this is what we are going to do. We'll be attempting to validate and evidence our digital products, bought and make it all open source, 100% open source, so that whatever you have built, thousands and millions can take it forward. And this is how the science develops. This is how the medical science has developed. Like you do some work very seriously, scientifically, and then there are teams like Turn.io team, which bring like very special kind of expertise and help you So this is my take on that question, that, ultimately engage in maximum ways, not just in profitable ways, if you want to take the impact forward. For such large problems we have in health, and even like agency related, most of the problems are too big to be handled by 1 to 100 startups or organizations. Yeah.
Fantastic. Thank you so much. I see, Zhao, you also have your hand up. Maybe you want to jump in and add your thoughts to that.
Sure. Just to confirm, can everyone hear me? Is it okay? Sounds good. Okay. So I'm in an event here in the Ministry of Health, and that's actually related to my point to this excellent question. So what we try to do here as ImpulseGov, and I guess this has to be very context specific, is try to leverage other stakeholders and other people in organizations and governments that are doing great work and actually getting closer to the outcomes of patients, because as NGOs, as organizations, it's hardly the case that you can actually do it all by yourself, right? So, for example, in our case, those numbers that we showed about Brazil, over 50,000 people dying every year because of primary care failures, the government has already decided to incentivize cities to improve this, right? So, for example, when we talk about cervical cancer screening, I think we actually mentioned this on the slides, right? Cities get paid to do this. So what do we have today at ImpulseGov? For example, we have 600 cities waitlisted. So we can't actually serve every city that is asking for our support. Why are they waitlisted? Why are they want what we are doing? Because they get paid and they have the health community workers to actually do cervical cancer screening, for example. So we don't have to do any cervical cancer screening. We just need to make sure the government knows who to reach, who they have reached already and who they haven't, and then leverage WhatsApp, which I was surprised to see the numbers in India, always pretty big numbers in absolute levels. But also, if I'm not mistaken, that's less than half of the population. In Brazil, we are talking about over 90%. And I guess that's also super context specific. But if you have 90% of penetration, and you're just this missing link of government capacity, exams available, healthcare workers available, you just need to know who you need to reach and reach those people and convince them to do the exam. That's easier, right? Way easier than actually providing services. So with this strategy, we can get very close to patient outcomes because we are leveraging the healthcare system, right? And I guess that's partially what we are trying to do here, and I'm sure can be done in different countries, adapting to the context, because not everywhere you have the same conditions. But I think that's actually the most important question we ask every day at ImpulseGov, because in the end, it outcomes that matters, right? We don't want to send messages, we want to reach people and improve their health.
Thank you, Zhao. I see we've got Joy here also from Vida Plena wanting to add her thoughts on it.
Sure, thank you so much, everyone. And I think this is something that we've really talked a lot about during the Accelerator. I think like Addis and the agency fund did a really great job kind of highlighting this through some of the exercises and me as well. Just thinking about like, what are the ultimate impacts? And so for us in Vida Plena in Spanish means a flourishing life. And that's actually what we're really after, is not just like helping people to be depression free, but have that next step of like living a flourishing life. And so through that, like I mentioned, I put in the chat, like we carefully track people's depression scores and their anxiety scores as they enter the program every single week, at the end of the 8-week program. And then we do 3 and 6 month follow-ups, because for us, it's not successful. We wouldn't be successful. I wouldn't consider our program successful if we check in 3 months with people and they're back in the same place where they started. And that's the reason we're using this evidence-based model. We're the first people implementing it in Latin America, but it has over 15 years of tremendous amounts of RCTs, research. It's used by the Ministry of Health in Lebanon. And that's why we're using this model, but we want to be able to demonstrate the effectiveness also in Latin America. And ultimately for us, we also are looking at long-term as like tracking subjective well-being. How do people overall rate the quality of their life? And then in future stages, we're going to start looking at the impacts on family and kids, because really those are the bigger picture outputs. So I guess going to your answer is like, it's thinking through carefully, what are the overall outcomes, and making sure that you're tracking the indicators that lead toward that. And so like some of those leading indicators and those other pieces, had a lot of great presentations here in the Accelerator to help us think those pieces through, and been really grateful for all that collaboration that we've received.
Thank you, Joe. I see Mercy from Access Afia also have some thoughts. Over to you, Mercy.
Thank you for that. I think I just want to concur with Joy about having the metrics that you want to achieve, especially outcomes being the end goal, and focusing on that. But in addition to that, also having that theory of change. So it's going beyond just the reach. It's going into, do you want to go wider or deeper? So wider, looking at, you want to reach as many people as possible, but deeper, changing that outcome. So I'll give an example of what we're doing with maternal and child health program at Access Afya is we are seeing mothers coming to the clinic average once, and we're trying to improve that through this WhatsApp chat engagement to get those visits to an average of 8, which is what is recommended by the Ministry of Health. And that means going beyond just reaching them with the information, but also tracking them. And that's why, as part of this engagement, it will be the next steps will be to link our chat function with our EMR to just ensure that these women are actually coming to the clinic for the visits, or they're talking to the doctor online using a telehealth platform, and therefore ensuring that the outcome that we are looking for is actually achieved.
Thank you so much for Mercy. And I want to make sure we stay on time. Dr. Abio, do you want to quickly add your thoughts?
Yeah, so thank you very much. So I just want to share how we kind of look at how we measure our impact and how we also measure the outcomes. So one of the things we try to do is that we try to see all the product and the digital innovations that we have. We try to look at what are the best way in which we can have the maximum outcome and output out of all these things. I'll give you an instance from what we are doing. So for what we're trying to do to improve immunization outcomes in Nigeria and with state governments. So we currently have 2 states that have adopted our innovation. One of the things we try to do is to look at all the interventions that we have, which of them is more effective and which of them is helping us to reach the outcome we want, which is to help mothers take their children for immunization, because that's the outcome we want to see, so that they don't die of vaccine-related death. We were previously using SMS before the chat came in, and we noticed that chat was much more interactive. Like, people could ask questions. Unlike SMS, when you send a one-time SMS, people can't respond, they can't ask questions. Chat was more interactive. Second thing was that it was also much easier for us to collect feedback through chat, through our WhatsApp. Before, through SMS, we have to make phone calls. We have to call them after they've taken, have you taken your child for immunization? And that was like very stressful to collect. But now with just a click, we can send everybody we sent reminders to with the chat last week. We just a click this week, we can send them the evaluation form and they will give us the evaluation without having us to call them. It's less stressful. It's less, it's more faster. So I think one of the things organizations can look at is that you can try several models to actually measure your impact, and look at the one that is very much faster and much effective to measure the outcome of what you are trying to achieve.
Fantastic. Thank you so much. So, I mean, there's tons more questions. We are going to take the questions and we're going to add it into the chat for Impact Community WhatsApp group. If you don't know what it is, the team will share a link and you can join and we can continue this amazing discussion, because I can see definitely there's a lot of interest and people want to share. But now, without further ado, I'm going to hand over to our another co-founder, Gustav Breikelt, who is going to close out the session for us. Over to you, Gustav.
Thanks, Lisa. Just give me a thumbs up. Can you hear me fine? Just audio.
And indeed.
Great. I'm just enjoying listening to all the comments. I kind of feel I'm encroaching on the valuable, just incredible information that everybody's sharing here. And yeah, I'm just kind of a little bit overwhelmed. You know, I feel a little bit like this is a family. We've been staring at our Zoom screens for the last 4 years. For those of you who were with us, which I recognize a bunch of people here. If you remember in 2020, when the pandemic hit and we were all locked in our houses, we moved house in the meantime. I know these are the same books behind me, but I feel like we've gotten to know a whole bunch of people. And what's super inspiring for me is just to see the incredible work that people have been doing over the last couple of years. you know, when we all started out a couple of years doing this, we had this belief that we could use technology and specifically chat to improve lives. But what's really been happening now with these accelerators, and we could just see how the geographic diversity is increasing. Today, just amazing. I'm especially happy about Latin America and the guys from Vida Plena and Impulso, and West and East Africa, India, Pakistan, just such an amazing geographic diversity. The use cases have grown. I don't know if you, for those who were here a couple of years ago, remember when we started out, a lot of the use cases were infobots. You know, it was, okay, I'm going to have a bot, I'm going to say hi, and then there's going to be a menu. And what I'm seeing now is that all the use cases are really functional. Not only is there human support, but they're like really interesting functional use cases. I think specifically the mental health angle, like Coco and Vida Plena, and some of the other organizations, I think that's clearly a need. And I think we're seeing a lot of evidence in mental health where we're going beyond just providing support, but really providing functional benefit. And we're seeing evidence in the form of RCTs already on some of these. Even though this is a very new format in which to communicate, we're seeing really good evidence coming out around this. And I think really impressive, these new use cases. I'm sure we're going to see a lot more coming in next year. Business models as well. We used to work only with governments and nonprofits. We're seeing a lot more market-based solutions, which have other ways of scaling, which I think is really exciting. But I think maybe just all I'm really here to do is just thank everybody here. It's lovely seeing this incredible code of organizations. Obviously, first of all, the teams that did this amazing work. I'm so inspired by your work. I hope we can help you more. The accelerators are here to firstly provide you with some technical support and mentorship. And I want to thank all the mentors. I know a bunch of you, I can see some of you here, the amazing work that you've done to support these groups. Obviously, the funding, Aras and the team from Agency Fund in supporting us with further funding. And then our own team, Turn, Lisa and Pippa and every else from our team. I see Indrani there. Thank you for your amazing dedication through the last couple of years and supporting these groups. And of course, WhatsApp for building the platform that's making this possible and to be able to scale to this kind of nature. And then the last group I want to thank is the community. We've now, I think over the last 4 years with accelerators, we've had a couple of thousand applications. We have more than 10,000 people in the community. We've got a couple of hundred services now. I think it's more than 400 services that have been on the platform, of which over 300 are live. It's a community, it's you guys that are doing this incredible work that is changing people's lives. Half the world's population don't have access to affordable healthcare, quality healthcare. It's 4 billion people, and the services you guys are building are making the difference and connecting them to this kind of healthcare and services. So what's next? It's almost the end of the year, thank goodness. We are going to, towards the end of the year, we're going to have a summit. This year it'll be virtual. So unfortunately no beach time in Cape Town this year. So but we are going to have a summit. It'll be virtual and it will be towards the end of the year in December. In 2024, we're going to be accelerating the accelerators. We'll be doing more of this work. Russ already mentioned this. Thanks to their support and the support of OpenAI, we'll be launching we already announced it, but we're launching early in the new year an AI accelerator. If you guys want to have early access to some of the information, please go. I think we'll post a link here into the chat window. Please go there and have a look at the information and sign up, please, if you want to find out more about that. And then we'll be doing another health accelerator in the new year. That'll be after the AI accelerator. And we will be doing more health work like this. I'm really interested to see what the other use cases will be that we'll see there. And I think maybe to end off with for today is just to thank everybody for this amazing work. Thank you for the time. Thank you for the work you're doing for us and with us and for our communities. We're doing this to connect the world to affordable, quality healthcare. And with that, thanks to our team, it was just incredibly inspiring today to sit and watch these use cases. And we hope to see you at the next accelerator. We hope to see you at the summit. And thank you.